Why is cystic fibrosis severity so variable with identical mutations? Imagine two people with the same genetic change in the cystic fibrosis gene. One might have mild symptoms, while the other faces severe health challenges. Why does this happen? Even when the same mutation is present, the disease can look very different from person to person. This is because cystic fibrosis is influenced by many factors beyond just the gene mutation itself. First, even with the same mutation, the amount and function of the cystic fibrosis transmembrane conductance regulator protein can vary. This depends on how the gene is regulated inside the body. Certain regions near the gene, called regulatory elements, can affect how much protein is made and how well it works in different tissues. Variations in these regions can lead to differences in disease severity, even among people with identical mutations. Second, other genes outside the cystic fibrosis gene, known as modifier genes, also play a role. These genes can influence how the body responds to the disease. For example, some modifier genes affect immune responses, inflammation, or mucus production. Variations in these genes can make lung infections worse or better, or influence pancreatic and liver function. This means that two people with the same mutation might have very different disease courses because of these other genetic factors. Third, environmental and lifestyle factors are crucial. Exposure to infections, air pollution, nutrition, and how well someone sticks to their treatment plan can all impact how cystic fibrosis develops. For instance, a person living in a cleaner environment with good nutrition and consistent therapy may experience milder symptoms compared to someone exposed to more pollutants or with less access to health care. Fourth, the relationship between the specific mutation and the disease's severity is complex. Some mutations, like F508del, are common but can lead to different outcomes in different people. This variability is partly because the mutation affects the protein in different ways, and residual function can differ. Some mutations allow the protein to work partially, leading to milder symptoms, while others cause a complete loss of function. In summary, the severity of cystic fibrosis with the same mutation depends on a mix of genetic regulation, other genes, environmental influences, and individual biological responses. This complexity is why predicting disease course based solely on the mutation isn't possible. It highlights the importance of personalized care, ongoing monitoring, and tailored treatments for each person living with cystic fibrosis. Always consult healthcare professionals for advice specific to individual circumstances.